Hi, I'm Dr. Bill Sterett with Vail Summit Orthopedics and Neurosurgery here in Vail, Colorado with another one of your Sports Medicine Minutes. This is just going to be educational. You don't have to remember too much about this at all. But for years and years and years, we always talked about joint preservation. How do we preserve the joint? How do we not have to have a joint replacement? Well, in fact, what we were really talking about is activity preservation. I'd like all of the dynamics and all of the discussion to revolve around activity preservation more than joint preservation. Meaning, the only thing that matters to you or to us is, can you do the things you want to do? The art of all this is us having the least amount of invasive techniques to get you back doing what it is you want to do, but not dictating what it is you should be doing, if that makes sense. You'll see on the screen that we use a combination of things called a SANE score and then a Tegner activity score. SANE score is real easy. It's a simple alphanumeric evaluation telling us what percent of normal you think your knee or shoulder is. So if you think your knee is only 70% of normal, you'll write 70%. If you think it's 30% or 90%, that helps us a lot. Somebody who's at 95% of normal, we probably don't need to intervene all that much. Somebody who's at 20%, we probably do. It's been validated time and time again, showing that that's very consistent. You may not remember what you said 6 weeks ago or 6 months ago, but when you write it, it's very consistent. I'm doing a little better. You wrote 68% as your SANE score, and we look back 6 months ago, you were at 50%. So it's a very valid score for us to ask. The next thing we really look at is this activity score. Tegner was a guy in Sweden that wrote about this in the 70s, and we still use his activity score with some modifications now. We want to know what your highest level of activity in the course of a week is right now. And you'll check the box. Recreational skiing, for example, is 6 out of 10. National elite level soccer is a 10 out of 10. Sedentary work or just sitting on a couch even is a 1 out of 10. So everything's going to be a spectrum. We want to know not just what you're doing right now, but what it is you want to do. So if you're currently at a 2 and you want to get to a 7, you don't necessarily need to know what a 2 and a 7 is, but you know we got a long ways to go. So if you're at a 2, want to get to a 7, and your SANE score is only 30%, right off the bat, I know I need to do something, whether it's therapy, an injection, an MRI, possible surgery, but I got to do something. I can't just reassure you. If you're coming in at 95% and you're at an 8 and you want to get to an 8 and you're just checking in to make sure it's safe for you to go skiing, I know I don't need to do too much. So that gives us so much guidelines about what interventions we may need to take for you. So look this over. If you can freeze frame that screen or anything like that, but look it up, the SANE score, look up the Tegner activity scores, email us, tell us where you are, tell us where you want to get to, and that helps us guide your interventions that might be required. I'm Dr. Bill Sterett with another one of your Sports Medicine Minutes.